The team at Journey Clinic specializes in 3 state-of-the-art bariatric surgeries: gastric sleeve, gastric bypass, and lap band. The skill of our surgeons is just one reason Journey Clinic is recognized as a bariatric center of excellence by the nation's leading accreditation organization.
Choosing which weight loss procedure is right for you is one of the most important decisions you will make. At Journey Clinic, we have several safe and effective options.
Gastric bypass surgery has been successfully performed since the 1960s. The procedure used to be done with a large open incision. Today, at Journey Clinic, our surgeons utilize the latest in bariatric technology. 95% of our gastric bypass surgeries are performed laparoscopically, with small incisions in the abdominal wall.
It's really considered the gold standard procedure when it comes to weight loss surgery. And when we say gold standard, that's the procedure that other procedures are compared to. The first thing that we do with gastric bypass is we create a small stomach pouch. And when we create that stomach pouch, we're leaving about 5% of your stomach that is used. The remainder of your stomach is actually bypassed. And although it's functional and it's still living and it could be used 10 years from now if you needed it again, it is not utilized normally after the initial procedure.
The advantages to gastric bypass include rapid, consistent weight loss, sustained weight loss, and significant improvement in obesity-related health problems, including the remission of diabetes in many cases.
There are some individuals who will not see success that we expect with any procedure, but the success rate is the highest with gastric bypass when it comes to weight loss.
Gastric bypass disadvantages include nutrition deficiencies, ulcers, and restrictions on non-steroidal anti-inflammatory medications.
So most people will consider that gastric bypass is the most invasive of the procedures that we offer. Even though it's done laparoscopically in a minimally invasive manner, the surgery itself is still considered extreme by some and still considered to be invasive. And that's because we are bypassing or rerouting a portion of the stomach and the small intestines. And so some people are not comfortable with the possibility of rerouting their intestines. People may be more prone to developing nutritional deficiencies after gastric bypass. And it's certainly something that has to be monitored.
Studies show 30 to 40% of patients may develop nutritional deficiencies if not taking the appropriate supplements.
Some of the other disadvantages of gastric bypass are the risk for something called a marginal ulcer or ulcer formation in the pouch. And that is more common in individuals who have to take anti-inflammatory medications.
If you take ibuprofen, Mobic, or Aleve, or if you are dependent on medications for joint issues, then gastric bypass may not be the best option for you. Another disadvantage to gastric bypass surgery is called dumping syndrome.
If an individual eats something that's very concentrated in sugars, sometimes it can happen with something that's very concentrated in fats, then those foods will reach the digestive system without being diluted, without being broken down, and that causes a release of digestive juices to help break those things down. Well, the side effect of that is something called dumping syndrome, and it can cause intense abdominal cramping, dry heaves, nausea or vomiting, cold sweats. It's really a miserable experience for someone that experiences dumping syndrome.
Dumping syndrome is avoidable, however, by following the prescribed diet instructions following surgery. Gastric sleeve surgery is a laparoscopic procedure where a portion of the stomach is surgically removed, leaving a small sleeve of a stomach.
When some people hear the word sleeve, it sounds maybe like there's an implant or you're actually kind of wrapping something around the stomach, but the truth is that we place a narrow tube into the stomach. We use that tube as a sizing device, and then we actually remove about 70 to 80% of the stomach. So what you're left with is a narrow stomach tube or a sleeve of a stomach, and so that's where the name gastric sleeve comes from.
The advantages to gastric sleeve surgery include its ability to help curb hunger and results in effective, consistent weight loss with a much lower risk of dumping syndrome, no rerouting of the intestine, and there are fewer restrictions on non-steroidal anti-inflammatory medications.
It is highly effective for weight loss. It is comparable to gastric bypass, maybe not quite as good in terms of the weight loss as we see with gastric bypass, but it does have effective, consistent weight loss, and so that's certainly an advantage of the gastric sleeve. One of the other advantages is that there's no rerouting of the small intestine. So compared to gastric bypass, which involves rerouting, there is no rerouting with the gastric sleeve.
Disadvantages of the gastric sleeve procedure include a potential for acid reflux to worsen after the procedure. Also, gastric sleeve is not reversible, and there is less long-term data available about gastric sleeve because it's a newer bariatric surgery. The third procedure we're going to cover is lap band surgery, another laparoscopic procedure. It is considered the least invasive. Lap band surgery is often an outpatient procedure, only occasionally requiring an overnight stay in the hospital. The lap band is also known as the adjustable gastric band. The procedure involves implanting a device around the upper portion of a patient's stomach. The band constricts that portion of the stomach, forming a pouch, and restricting the amount of food a patient needs to feel full. The band is attached to a port, surgically placed near the muscle in the abdominal wall. After surgery, our staff can adjust your lap band with a special needle inserted into the port to fill a balloon with fluid.
When we fill the balloon, it narrows the opening, which slows the release of food from the little part of the stomach pouch on through the digestive system. So it's what we call a restrictive surgery. That means that it restricts the amount or the volume of food that you need in order to feel full. The lap band is considered the least invasive of all of the surgical procedures that we have to offer, so that's appealing to a lot of individuals.
Here are some advantages to the lap band procedure. It is reversible with a low risk for malabsorption. It is considered the least invasive bariatric procedure, often allowing a patient to return to work quicker than gastric bypass or gastric sleeve. Disadvantages include a possibility the implanted device will require maintenance. The band may slip, erode, or leak, requiring a second surgery.
If the port becomes detached from the muscle, or if the tubing to the band breaks, then those are problems with the device itself. There's also something that can happen called a gastric prolapse, which is basically where the stomach moves or migrates up through the band, and that can lead to things like blockage or severe reflux or severe vomiting, and those are things which require another surgery to be corrected.
Weight loss following lap band surgery is not expected to be as effective or as dramatic as other bariatric procedures. Each of these bariatric surgeries has advantages and disadvantages. It's important you talk with our team of experts about the procedure that's right for you. It's also important for you to keep in mind, no surgery is risk-free.
So you have to take this into consideration for yourself and for your friends or family members. There are some serious risks associated with weight loss surgery. And when it comes to serious complications such as death or blood clots or leakage or severe infection, although these things don't happen frequently, there's still a possibility and you're exposing yourself to that risk. So you really have to understand that there is nothing that we do in surgery or in medicine that is without risk. So you have to be ready to take that step.
Surgery can be an extremely effective tool for losing weight.
General side effects of weight loss surgery include nausea, diarrhea, constipation, lactose intolerance, hair loss, excess skin, depression, and psychological distress.
Although it's a decision that I say you shouldn't make lightly, it's still a decision that can be the right decision for you. I really don't think that the risk would stop you or preclude you from having surgery, because we expect that on the other side you're going to be happier, you're going to be healthier, you're going to have a decrease in your health problems related to your weight, and so that's why we offer this as an option for you.